You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Dr. Michael Ling. Dr. Ling, welcome to the program.
Thank you, Randy.
Good. Now, I know you brought a stack of photos, so we'll try to get to as many of those as possible. We looked at them in the green room. Pretty dramatic, by the way. Now, for people that don't know your practice, like who's the typical implant patient?
Well, Randy, I wouldn't say there's one typical implant patient. There's really two different categories of patients that end up coming to see us. The first category are patients that have really bad teeth. So they've got badly broken down teeth, they've got really bad gum disease, bad breath, sore teeth. Train wreck mouths is what we call them. So they're people that are at the end of the line and are scared that one day they're going to have to wear dentures, and they don't want to do that. And for those people, what we do is give them a brand new set of teeth that are bacteria free, that look good, that don't have the smell anymore, and that they can eat whenever they want on.
Okay, good.
The second group of people that come to see us are the ones who already have dentures. So they might have been in dentures for 5, 10, 20 years, and they want something better. They can't enjoy their lives the way they are. They want to upgrade what they have to something that's more comfortable and looks nicer. So we give them also a new set of teeth that's fixed in their mouth and never comes out. It feels a lot like the teeth they used to have before they went to dentures.
I think we've talked about this. You say that you could probably help the denture wearers the most, but it's hard to get them in.
Right.
Because they just don't go to the dentist anymore?
Right. Yeah, if you've got dentures, Randy, you and I, you get your teeth cleaned every 6 months is what the average patient does. But once you have no more teeth and you're in dentures, you're out of that loop. You're not in that cycle anymore. So you're not coming to see the dentist every 6 months. So you just don't know what options are out there for you anymore.
Okay, and so there's a lot of people in Canada.
Sure.
Like throughout Canada.
Yeah, it's a big problem. So you know
dentures.
Sure, you know the Rogers Center where the Blue Jays play.
Okay.
You could fill the Rogers Center 10 times over with patients that are right now wearing upper and lower dentures in our area. And you could probably double that number of people with people who are at the end of their life with their teeth and are about to go into dentures. So it is a really, really big problem.
So if getting new teeth supported by implants is so good, why aren't they all doing it? Like, what's your take?
That's a great question, Randy. And I think there's a handful of reasons why these people don't take the next step and upgrade their dentures. The first is, like we said before, once you are in dentures, you're just not seeing the dentist anymore.
Okay.
You might go to get relines done, you go to get sore spots adjusted, but you're just not in the cycle. So you don't have a dentist there that's always telling you about the latest and greatest that's available for their dentures.
Okay.
The second reason is, Randy, when people are in dentures, it's not an overnight thing where they go from healthy teeth to dentures.
All right.
It's tens of years, sometimes 30 years of broken down teeth, getting them fixed again and again and again, having bad breath, bad gum disease, going to see the specialist. That doesn't quite work, so they're going back and forth to different specialists, getting root canals done, root canals redone, crowns broken, oral surgeon going all over the place. So when patients finally get rid of their teeth and go into dentures, one of the most common things that I hear is they're just relieved. They're done. They don't want to deal with dentists anymore.
Last thing they want to do is see you guys.
The last thing they want to do is go see yet another dentist and pay for yet more treatment that just never quite feels right. They're finished. So they just settle for what they have, and they don't know what else is available.
If all the denture wearers, like you're saying there's close to 1 million people, let's say, in all of Canada, if they all figured out how good this was, there's not even enough dentists to help them. Is there truth to that?
Yeah, it's a huge problem. And the problem is that people that are wearing dentures, their dentures are not attached to anything. They're just floating there. So they're held in literally by gravity or suction. So
I know a couple of denture wearers. They never complain.
Well, Randy, they don't complain to you because you're not a dentist.
Okay.
We hear it all the time from our patients that patients come in with their dentures and they are just sick of them. They want something better. Let me tell you what it's like to be a denture wearer. If you're a denture wearer, what I hear from my patients is they just can't eat the things they want to eat. So you go to a restaurant, when you and I go to a restaurant, we think, well, what do we feel like eating? I want the steak today, I want the salad, get the lobster tail, whatever you want. If you're a denture wearer, that's not the way it works. You got to think about, what can I eat today without me getting stuff stuck around my denture and my teeth falling out in front of my friends? So I can't have the salad today, I can't have the raw veggies, I got to stick with the mashed potatoes, the soft food, the things that are low risk to cause me to get food stuck around my teeth and my teeth to fall out in front of my friends. And then when they order something, they're always excusing themselves to go to the bathroom, not because they have to go to the bathroom, but because they got to take their teeth out and wash them before they go back to the table. So you're sitting there in the washroom, and you can't do it in a stall. You're at the sink taking your teeth out, doing as fast as you can, hoping nobody comes in behind you and sees you with your teeth in your hand. It's really, really embarrassing and debilitating for these people. And that's what it's like to be a denture wearer. I mean, a lot of our lives are centered around socializing with our friends, and a lot of those times are with meals. So if you're a denture wearer, especially people...
You avoid those situations?
You avoid those situations.
Okay.
So a lot of my patients say that, you know, they go out to play pickleball, which is the hottest thing these days.
Okay.
They go bowling, bingo, and afterwards, what do they want to do? Their friends want to go out for lunch. And the patients that wear dentures, they hold themselves back. They make up an excuse saying, oh, I got to get home, I have another appointment, I got to go take care of the dogs, got to water my plants. But really what they're thinking is, we just had a great time. I don't want to ruin it by going to lunch, and now I can't eat the things that I want, and my teeth are going to fall out in front of my friends.
So with these patients that get their new teeth supported by dental implant, they can eat whatever? Or are they restricted? I mean, they can eat whatever they want?
Yeah, you can eat whatever you want. So, I mean, I hear patients come back, and these patients, the one lady I met, her name was Tanya, and we finished her teeth, gave her full upper and lower teeth, and I told her, Tanya, I mean, these teeth are for chewing. Like, this is why we did this. You go out and enjoy. Like, take these for a test drive, and let me know how it goes.
All right.
And she keeps emailing, you know, every month saying, oh, is it okay if I have a salad? I'm saying, yes, you can have a salad. The next month, is it okay if I have a steak? Yes, you can have a steak. And the way she put it to me is, she's like, you know, you watch those nature videos and the baby giraffe comes out and they're kind of wobbling along.
Yeah,
she's like, I'm the baby giraffe, kind of learning how to eat again. But eventually she learns that, yeah, you can eat with these teeth just like a full-grown
So
giraffe.
what do they like more? Do they like what they can eat, or do they like how it looks better?
You know, it's both. So when patients come to see us, usually there's one main concern that they're worried about, but they end up really enjoying the side effects just as much as their main concern. So for example, there are patients who come in and they just want their teeth to look better.
Okay.
Right? All they want is the nice, white, straight teeth that look like they did when they were 20 years old.
Okay.
But what they discover is that not only when they're finished, not only do their teeth look nicer, but they forgot how important those teeth are for tasting their food and for eating the foods that they want. So we had a patient, her name is Elsie, and she came in and all she wanted was, she said, Dr. Ling, I just want my teeth to look good. I've got, you know, weddings coming up, I've got vacation plans, I just want to be able to smile. When we finished her teeth and she came back to see us again after that, she said, Dr. Ling, I have a bone to pick with you.
Okay.
And you know, as a dentist, you're thinking, well, uh-oh, what did something break? Did I do something wrong?
Okay.
You're not happy? She's like, you owe me, because since I've had my teeth done, I've spent more money than I ever have on things like vacations and food and going out with my friends. And it's all because of my teeth.
That's
and
nice.
I never realized how much I miss them. And she says to me, you know, do you ever go to a friend's house or a neighbor's house and you walk in the door and you're just hit with that apple pie? So they're baking a fresh apple pie.
Okay.
Or they're baking, you know, fresh cookies, and it just hits you in the face. She said, Dr. Ling, you're young and you don't know what it's like, but when you're wearing a denture, you cannot taste your food the way you used to.
Because the roof of the mouth is covered?
The roof of the mouth is covered,
Okay.
and you just learn to adapt. And now that's not there, it's like every time I eat something, it's like getting that apple pie hit me in the face, because it's a
Nice.
sensation that I've missed for 20 years. And all she wanted to start was to look nicer, but she realized that, you know, all these side benefits were really just as impactful.
But what if you have bad gums? I mean, like bleeding gums, bad breath, like the gum disease. Are the gums too bad to hold implants? Can you still do it?
Sure, these are the types of patients that come to see us.
Okay.
If you've got healthy gums, you don't have these problems. The ones that come to see us do have really bad gums, really bad bone, really bad teeth, really bad gum disease.
Okay.
And we can clean all that up, get rid of all the decayed teeth, all the bacteria, and make them have a full set of healthy teeth again. And back to your original question about, well, why doesn't everybody come in and do this? And another reason is because they think that they're too old.
Well, how old can you be to get it done?
These days, 80 is young. I have a colleague who just did a full set of teeth on a 100-year-old.
Really?
Yeah.
So why would a 90-year-old or a 100-year-old want to do this?
Because they want to eat and chew. If you're lucky enough to make it to 70, 80 years old, a lot of your life revolves around eating. You want to be able to enjoy your meals. You want to be able to enjoy your life. Now, I had a patient recently.
Okay.
His name was Ed. And Ed was 83 by the time we fixed his teeth. So I said to Ed, what's making you finally do something about your loose teeth? And he said, Dr. Ling, when you get to my age, you begin to appreciate life. And you also begin to appreciate how short life is. He said,
Okay.
I've made 80 trips around this earth. I want to enjoy my last 20. I want to make my last 20 trips around this earth count. And there's no reason for him to settle for teeth that were holding him back from enjoying his last 20 trips around the earth.
Very nice. Now, we should mention you come from a dental family. Your dad's a dentist. Your wife is a dentist, works in the practice.
Right, and the things that we're doing today, my dad never got to do when he was younger in his career. So I'll tell
What do
my
you mean?
dad.
What do you mean?
Well, I'll tell my dad that, we're giving people their full set of teeth back in, 1, 2, 3 visits. And he's like, well, how are you doing that? Like, that's impossible. And I have to explain to him, no, I mean, things have come a long way since he was my age and doing these things for his patients. And, the options were dentures.
Right.
Denture glue.
Or bridges or things that came in and out.
Yeah, maybe the odd implant, but certainly not the things that we're doing now. So his mind is just blown with how easy we can make this for patients now. Whereas, back then, maybe they could do it, but it would require, tons of time, multiple different visits to different specialists, multiple visits. Now we can compress all that into just 2 or 3 visits, and people walk out with a full set of teeth.
Is this the future of dentistry? Whether it's 20 or 50 years, like dentures as we know them today may be eliminated? Everything will be attached to something, like an implant?
Yeah.
What are your thoughts?
I think that is the latest trend, and that's where everything is moving, where patients don't have to suffer with loose-fitting or uncomfortable dentures. There is a better solution.
Okay, now you're here in California taping this. In the U.S., it's typically done in 2 places, implant dentistry. You go to the surgeon, or you go to somebody that does the placing of the implants, then you go to another doctor that puts the teeth on top, and then most of the time you go somewhere else to get it cleaned. Is that the way it is also in Canada? We're usually done in 2 places?
I've had training on both parts, so we do all of it in our own office.
All right there.
Yeah.
Is that why you're able to do things very quickly?
Yeah, there's much less going back and forth between different doctors where things can get confusing or take longer. We just get it all done in 2 or 3 visits, you're finished.
Now, I know when you agreed to do this, you said, I want to be very positive because we have good specialists in this town, the oral surgeons, periodontists, prosthodontists, endodontists, etc. So you still work together with those guys in many cases.
Oh, we've got great specialists in our area. We all work together and collaborate on these cases for sure.
And we're going to get emails about this. Insurance. I know here in the U.S. It's really not covered by insurance. Maybe a very, very small part. Is that the same way in Canada?
It's the same way. Yeah, we tell our patients not to count on the insurance. But Randy, people are financing this, and they're really surprised at how affordable it can be.
She brought some photos. Let's go there. What are we looking at?
So Randy, this is Marilyn.
All right.
She's a patient of mine for many, many, many years. Probably 12 years I've known Marilyn. And she had worn a top denture and a bottom partial denture for all that time. And she was never interested in doing anything about it. She'd say, things are fine, I'm okay. I know there's other ways, but it's just not for me.
Okay.
Until one day she came in and said, hey, Dr. Ling, I want to talk to you about this because I think I'm finally ready to do something about my dentures. I said, great, Marilyn, we're happy to help you. But just so I know, I'm just curious. What's made you change your mind? Why now? What's making you want to do something about this now? And she said, Dr. Ling, you know that 5 or 6 years ago I started having some grandchildren, and now I've got 3 grandchildren.
Okay.
Well, on the weekend, this past weekend, I was at my daughter's house, and I went to kiss my grandchildren goodbye, and they pulled away from me. And I said, I thought they were joking at first, and she said, Dr. Ling, I asked my grandkids, what's wrong? Why won't you give grandma a kiss goodbye? And you know how kids are. I mean, they've got no filter. They'll tell the truth.
Okay.
And she said, my grandkids told me, but Grandma, your teeth are all yellow and smelly.
Oh, wow.
And that just broke her heart. Yeah, so we gave her a full new set of teeth, top and bottom, and she loves them. She's so happy with them. She can eat whatever she wants. She can eat her salads, her cucumbers, or carrots, which she never really thought she wanted, but now she realized how much she missed those things.
Is that her after over there?
Look at the before and after here, Randy.
Okay.
Would you say that she looks nicer in the after?
Yeah.
She looks healthier.
Yes.
She looks happier.
Yes.
She
looks
more
younger.
Confident. She looks younger.
To me, she looks younger.
She just looks more confident and more healthier. And that's because she is healthier. Now she's eating better food. She's enjoying her life more. She feels better about herself, and it just shows in her appearance.
Is that the challenge? I think we talked a little bit about this in the green room, that people have a tough time doing nice things for themselves. Like in her case, it took her grandkids to talk her into doing this, right?
Yeah.
So there's a lot of people that, now is this one of those things where she goes, I should have done this years ago?
Absolutely. That's
most
the
people
one
say this?
regret we hear from everybody. She's had these teeth for 30 years, and what she said to me is, like, why didn't I do this 30 years ago? Imagine how different my life would have been if I had just done this 30 years ago. I missed out on 30 years of socializing, of hugs and kisses, of meals with my family. Why? And there's no good reason. What I hear from most patients that wait this long is there is a lot of guilt for doing something for themselves. And I think it's partly the Canadian in us where, she spends her time taking care of her kids and her grandkids, and she feels guilty about finally doing something for herself. And what I find is usually there's a tipping point where there's some excuse that kind of pushes them over the edge that gives themselves permission to finally take care of themselves.
Do couples ever do this together? Husbands, wives, like one goes in first, gets it done, then the other?
What I find is they don't usually do it at the same time. I think what they do somehow is they come to some agreement that, you're going to go first and I'm going to go second. And the best is when the husband lets the wife go first.
Okay.
Right? So we have a lot of couples that come in. The husband says, you know what? I've got really bad teeth. Eventually I'm going to need my help, but I want her to get hers first.
It's like a guinea pig, like they're testing it out secretly.
I hope it's not guinea pig. I hope it's being a gentleman.
But it's all done. They come back in and they just say, I'm in. I want to do this.
Right. Yeah.
Good.
So here's another patient.
All right.
This is Lisa.
Oh, wow.
When I first met Lisa, she told me she's too young to wear a denture. She's in her 40s and 50s. And what I told her was, we're all too young to wear a denture. Even 80, 90-year-olds are too young to wear a denture. Should never be wearing a denture. She should never wear a denture.
Okay.
But she'd had some really bad problems when she was younger and had lost lots of her teeth in her 30s, and she'd been wearing a denture for 10 or 20 years. Patients like this that come in, a lot of them are getting back into the dating scene. So I don't know if you knew, Randy, but the largest growing segment in online dating is seniors, the 50s, 60s, 70-year-olds.
Okay.
And they're all online. They're recently divorced, they lost a loved one, and now they're trying to meet somebody new online. And so they're terrified of meeting somebody new and that moment coming where they're going to have to take their teeth out at a meal, or they're going to go for an overnight trip, or they're going to go travel together. And how am I going to tell my new boyfriend, my new girlfriend, that I got to take my teeth out? And it's just embarrassing. They feel like they're 20 to 30 years older when they don't have their teeth in. So her option was to wear a cosmetic denture, which we would have happily made for her, but she chose to do something fixed instead. And this is what she looks like.
When you say fixed, we're talking about teeth that don't come in and out?
Fixed means secure in the mouth and never come in and out.
This is nice. I'm not trying to side with you, but these look really, real. I always feel like I could spot fake teeth walking down the street.
Right. What we go for is, we live in Canada. We don't live in Hollywood. We're going for natural, age-appropriate, something that blends in.
Looks good.
And it takes a lot of time and planning to do that. And that's what we do behind the scenes. So you see, Randy, how her teeth are not too long. They're not like long horse teeth. They're not super bright white. They're a nice natural white. The curve of her teeth follows the curve of her smile. So it's all
like the lower lip.
Natural. The lower lip.
Okay.
It fills out in her cheeks, so it looks very full, very happy. We want her teeth to match her smile and to match her face.
Okay.
So that's why we take extra care to make sure that it blends in. The teeth are not too long, too short, too fat, too skinny.
It looks natural. I mean, another dentist looking at that photo would never know by looking. Is that true?
That's
just looking like this at this photo?
Yeah, we're going for something that's natural, that blends in, that's invisible. We're not looking for just, bam, out there where everybody's staring.
You said you show them what their teeth are going to look like ahead of time. How?
There's different ways that we can do that. The first way is we can use almost like a digital Photoshop program. So we can show them what we think their teeth are going to look like based on a photo of themselves.
Okay.
The second way we show them is we can actually do a mock-up in their mouth. So we can make a trial set of teeth. We call it a smile test drive. They actually put it in their mouth and they can see what it looks and feels like on a video, in a picture, in the mirror, when they're talking, when they're smiling, when they're laughing, how everything moves naturally and fits naturally together. Let me show you this next patient.
All right, all right.
This is Tanya. Tanya came in because her sister convinced her to come in. So Tanya was always very reserved, very quiet, very to herself. So Tanya's teeth were really badly broken down. She had really bad gum disease. She had broken teeth. She had dark cracks and stained lines all over her teeth. So one of her options was to wear just a regular cosmetic denture, which we would have happily made her. But that's not what she wanted. So instead what we did is a set of teeth, a full arch of teeth that were secured in her mouth and never came out.
Okay, let's take a look at this.
Yeah, so this is what Tanya looks like now.
It does not look like the same person.
It doesn't. And you look at, when she came in, it's a real transformation. When she came in, she was, her hair was just all over the place, wearing an old sweater. When she answered questions, just one or two words, never really making eye contact, always looking down. And when she was done, it was like a brand new person. And she didn't know she was coming in for photos, but she came in, a nice blue cardigan, the pearl necklace, her hair done. And our staff all noticed, like, wow, like, what's with Tanya? We thought she didn't like us because she never smiled. She never said hi. She never said bye. She was always kind of looking down. And now she's just beaming, stopping at the front desk on the way in, on the way out, waving to everybody.
Can you spot people with bad teeth that are hiding them?
Absolutely. You see them walking
around. Like when you're out and about, you can tell who's hiding their teeth.
When you don't like something about yourself, it really holds you back. So there's people that don't like their hairline. They're always wearing hats. People don't like their bodies, so they wear loose, baggy clothing and never go to the pool, never go in a bathing suit. When people don't like their smiles, they compensate. They hide it. So they do things like they always, they cover their mouth with their hand when they talk. Or when they smile, they never smile with their teeth showing. They just, smile with their lips closed. So we had another patient named Lily, and when she came to us, what she said was, Dr. Ling, I'm looking back at our old photos, and what I noticed is that in all these group photos of, me and my girlfriends, my old friends from college, I'm the only one who's never smiling. And when I look back, I can remember being happy in these moments, but I don't look happy. I look so angry all the time. And what she realized is that because she didn't like her teeth, she learned to adapt and learned to hide her smile with her hand, or to take it at the right angle so it didn't show properly, or just to not smile with showing her teeth.
Now, something I got to ask you is pain. It seems very painful.
Randy, every one of our patients is numbed up. We have different levels of sedation, ranging from oral sedation to IV sedation. So our goal is to make this as comfortable as possible for people. Now, the people who go through this type of treatment are usually really scared of the dentist. That's how they ended up in this situation. They've had some really, really bad experiences in the past. But the important thing to remember is that pain or the fear of getting this done shouldn't be the reason why you don't
Shouldn't hold you back. No. Now, is this true? Like, for example, somebody watching this, if you had availability in your schedule, I mean, in the next couple of weeks, they could have a brand new upper and lower set of teeth. Is that right?
2 or 3 visits and you're done. You walk in with the teeth that you have, you walk out with brand new set of teeth that are secured in there and never come out.
We are just about out of time. So if a patient is one of the two groups, they either have really bad teeth that you cannot save and have to be removed, and they don't want dentures, and then the other group of people that are actually wearing dentures, what are their options in your practice when it comes to dental implants?
So one way to do it is doing 2 implants on the bottom and a snap-in, snap-out denture. It works really well, looks really nice. People can eat most of the foods they want, but there is some maintenance involved. They do have to come in and out. They have to be cleaned. And there is a little bit of movement when they choose. So maybe
but you're not a fan of those snap-in dentures.
I'm not a fan because most patients are not a fan of it. Now, it's better than a loose-fitting denture, and it's a more affordable option, but there are more secure ways of doing it.
Can you graduate them? I mean, somebody starting with a snap-in, snap-out set of teeth, you can move them to a set of teeth that don't come out?
Sure.
Okay.
Yeah, patients can always upgrade it later. What I tell them is you can try this as a more affordable option. If you don't like it, there's always ways that we can upgrade this in the future.
Okay, good.
So they could also do 4 implants on the bottom instead of 2, which is a bit more secure, a little bit more expensive, but a little bit more comfortable as well. Or they can upgrade to an even better option, which is a fully secured set of teeth. So what this means is, which is 4 or 6 implants, they can have a set of teeth that's in their mouth, looks fantastic, and never comes out. There's 0 movement, 0 rocking. It's rock solid.
They can eat whatever they want.
Eat whatever you want. And the best thing that a lot of patients say about this is it doesn't cover their palate. So they can finally taste their food. They can feel the temperature of their food. Your palate's covered with taste buds. And when that's covered with a piece of plastic, you just don't enjoy the food the way that you used to. So you can't taste the food.
You mentioned 80-year-olds are doing this. Study came out, most 80-year-olds on 4 or 5 medications. Can you be on some medications and still get this done?
Absolutely. These are the patients that we work on. There are not many 80-year-olds who are not taking any medications.
What about if it's a diabetes medication? Can they still do it?
Absolutely, yeah. We work on diabetics
As long as it's what? Controlled?
As long as it's controlled. But it's very, very, very rare these days that we meet a patient and tell them, sorry, we can't do this for you.
Will you talk to their medical doctor, or do you?
Sure.
Every once in a while?
We coordinate with their family doctors or their specialists. Sometimes the treatment is more difficult. Sometimes it takes more time. But honestly, I can't remember the last time we said, sorry, you're out of luck. We can't help you.
Now, we have about a minute left, but I got to ask you, because you're a dentist, you probably think the smile is the most important thing. How important is a smile, in your opinion? Teeth and gums.
Well, it's not because I'm a dentist. These are the facts. People with bad teeth are judged. Now, we all know you shouldn't judge a book by its cover. We were all taught that as kids, but we all do it. It's just part of our society.
Especially the movies.
In the movies, and this is where we learn it. So you look in the movies, and the hero of the movie, the star of the movie, you think Julia Roberts, you think George Clooney, they've got brilliant, straight, white, beautiful smiles. And then you look at the flip side. Every time the director of the movie wants to make somebody look scary, or wants to make them look poor or uneducated, or the villain, they have dark smiles.
That's
or
a good
worn
point.
down smiles. You look at Jim Carrey in Dumb and Dumber. They want to make him look dumb. What'd they do? They chip his front teeth because chipped tooth looks dumb, I guess, for some reason.
Yeah.
And that's just the way our culture is. So that's why smiles are important. It's not because I'm a dentist. It's because that's our society.
You say patients say that it changed their lives. Really?
It's a huge transformation. We have patients that come in that don't feel good about themselves, and you can just tell because just their energy is down, it's negative, it's quiet. And when they finally see themselves with their new smile, it just brings out their inner selves again. And that's what we hear from patients. They say, you know what, I feel like myself again.
Good.
I finally look the way that I want to feel.
Are you ever on a consult and you're hearing their hard luck story about how bad their teeth? Do you ever get kind of excited going, boy, they don't even know how good this is going to be?
Absolutely. It's we don't want to overpromise for people, but we just know, you know what? You're in for a treat.
Good.
This is gonna work out really nice.
Now I know your wife works in the practice. She does what, like the general dentistry, the children. You do a lot of kids.
She loves seeing kids.
But you're giving people their teeth back. Do you think like you have the better job secretly?
Randy, you're taking somebody with no teeth and you're giving them teeth back again. It's an amazing feeling and very, very rewarding.
We're out of time, but the two groups of people. Final message: somebody either has teeth that are so bad they have to be removed, they don't want a denture, or the denture wearer is watching this and they've heard what you had to say, but for whatever reason they're still skeptical or scared. What do you say to them?
I'd invite them to come in and chat.
Okay.
I mean, there's no harm in knowing your options. Come in, let's figure out what you're looking for, figuring out which of these options is the best one for you. The worst case scenario is they learn more about their options. They really have nothing to lose.
Okay, good. I want to thank you for coming on the show. So if they want to make an appointment, do they go online, go to your website, or they just call the office?
They can do any of those things.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.